Hi, I'm Dr. Parisa Rezaiefar. I'm an assistant professor with the Department of Family Medicine at University of Ottawa. I will be talking to you about pelvic organ prolapse as part of the Pelvic Health video series. Pelvic organ prolapse is used to describe several conditions, including uterine prolapse, cystocele, and rectocele. It happens when pelvic floor muscles and ligaments stretch and weaken and can no longer provide enough support for the uterus. The uterus slips into or protrudes out of the vagina. You may experience heaviness in your pelvis or tissue sticking out of your vagina. Urinary problems such as urine leakage or inability to empty your bladder can happen. You may also experience trouble having a bowel movement or stool incontinence. You may experience trouble having vaginal intercourse because the tone of your vagina may be affected, or because tissue that should not be inside your vagina is now inside the vagina. Pelvic organ prolapse can impact a person's well-being and lead to isolation. It can affect one's intimacy because of feeling of embarrassment. One may limit physical and leisure activities because they make the prolapse worse, and this can further become physically and mentally vulnerable. If you think of uterus as a hammock and the pelvic floor muscles and ligaments that holds it in suspension inside your pelvis as the cords from which the hammock hangs, and the abdomen and chest as the load on the hammock, you can better understand the causes of pelvic organ prolapse. Conditions that affect the uterus, i.e. the hammock, include large fibroids, pregnancy, delivery of one or multiple large babies, abdominal obesity, chronic constipation, lung disease that are caused by smoking can increase the load on the hammock and therefore impact the integrity of the uterus and the pelvic floor muscles, which are the hammock bands, and of course the vaginal walls. Estrogen deficiency from menopause, cancer treatment, or estrogen suppression in trans men can impact the vaginal wall, which helps with the bladder function and therefore can cause loosening of the surrounding tissue that are holding the bladder and the uterus in place. Collagen laxity and disruptions caused by aging, chemotherapy, radiation, medical condition, and smoking can also affect the surrounding tissue and pelvic floor. Hammock bands. These are supposed to hold the uterus, the bladder, and the rectum in place suspended. You can prevent developing pelvic organ prolapse or preventing it from getting worse by exercising regularly, monitoring your weight, especially how much weight you gain around your abdomen and around the time of menopause. You can reduce alcohol, coffee, tea, and you can stop smoking. You can avoid constipation by drinking plenty of fluid and eating high fiber diet. There are many excellent online programs that can help you with Kegel exercise. Kegel exercises strengthen pelvic floor. Your primary care provider may recommend a pessary. Pessaries are devices that can be safely inserted in the vagina to relieve symptoms of pelvic organ prolapse.